You're watching ABC4 News.
Welcome back. Coming off of Breast Cancer Awareness Month, we're meeting with Dr. Phoebe Freer from the Huntsman Cancer Institute. Dr. Freer, thank you for being here today. We're excited to have you. Okay, we're obviously November 1st. We just ended October Awareness Month. Tell us, how did it go for you, for your staff?
So it's good. We are busy. We're busier than ever. You know, the Salt Lake population has grown, and then breast cancer awareness is continuing to grow. The incidence of breast cancer is also increasing steadily, about 1% to 2% per year over the last couple decades. It's continuing to go up. So we've been busy.
Okay, why do you think that is? Why do you think that's increasing?
You know, that's a great question. Researchers are still looking at it. We don't know exactly. We know that there are probably some exposures that we have a lot, maybe when we're younger, certain things in our diet and environment, things that we're not fully aware of yet. But because we don't fully know what actually causes breast cancer at the cellular level, it's all the more important to continue to screen and to try to detect it as early as we can.
Okay, a topic clearly that should be top of mind for many. What would you say is your primary message for women going forward?
The number one thing is that all women, regardless of risk, should get screened with a mammogram every year, starting at age 40. If they are of higher risk or have denser breast tissue, they may actually want additional screening. They might want something other than the annual mammogram. So some women should start earlier, and some women should do other tests such as a breast MRI, maybe even something like a contrast, and in some circumstances ultrasound. But women should continue to get that mammogram. It's the only test that's been proven to save lives, and we know that in women who regularly get mammograms, it saves about 50% additional lives of breast cancer.
Okay, remind us that age. What's that age that we should be looking at to really take this seriously?
Yeah, for screening, it would be 40. For thinking about what your risks are, it really should be all women by the age of 30. So you want to start thinking, are you high risk? Obviously, family history makes you at higher risk, but 75% of women who get breast cancer don't have any additional risk factors other than being a woman. So one of the main messages is that just because you don't have a family history does not mean you're in the clear. It means you should still get screened starting at 40.
You said you've been at Huntsman Institute since 2015,
Yep.
Is that right?
Yep.
In your time there, in your career, what have you seen changed in terms of technology, in terms of treatment? What's changed over the years?
One big thing is that the majority of breast centers now use what's called digital breast tomosynthesis, or what you might hear referred to as 3D mammography, which is different than the old standard mammography. For a woman's experience, it's about the same, but it is a better test. It's more accurate. We can find more cancers, and we call back fewer patients unnecessarily for things that we might think is a shadow or something that way. It lets us page through the breast a little bit more clearly. We at the Huntsman are now 100% tomosynthesis. We have been for the past few years, so if you come, that's what you will be getting. But that's been a big thing. And then there's been a big push about dense breast screening. So if people have denser breasts, which is about 50% of the population, it's a normal thing to have dense breasts. And there's really not much within a woman's control over whether or not her breast tissue is more of that dense glandular tissue or more of the fatty breast tissue. But if you have that dense breast tissue, it's harder to see through, and there's a lot of research going through additional supplemental screening tests that we might use.
Wow, so a lot of things to keep in mind there, a lot of great information you gave us. If people are wanting to learn more, where can they go to find more resources?
So that's a great question. Just at the Huntsman Cancer Institute website, there are lots of resources, and there are also resources through American College of Radiology put out for patients, as well as Society of Breast Imaging.
Okay, you heard it there. You have some resources you can turn to at home. Again, Dr. Phoebe Freer here from the Huntsman Cancer Institute. Thank you so much for being here. We appreciate
Thanks so much
it.
for having me.